Aldactazide is a combination medication that contains two active substances, spironolactone and hydrochlorothiazide. Spironolactone is a potassium-sparing diuretic and hydrochlorothiazide is a thiazide diuretic. The combination helps to increase diuresis urine production while minimizing potassium loss. Indications: Aldactazide is indicated for the treatment of essential hypertension, high blood pressure, edema, fluid retention in patients with congestive heart failure, edema in patients with hepatic cirrhosis and nephrotic syndrome. How to use: Aldactazide tablets are taken orally, usually once or twice daily. The tablets should be swallowed well with a glass of water. The dosage of aldactazide is individualized based on the patient's condition and response. The recommended starting dose may vary. The combination of spironolactone and hydrochlorothiazide provides additive diuretic and antihypertensive effects. Contraindications: Aldactazide is contraindicated in the following cases: hypersensitivity or allergy to spironolactone, hydrochlorothiazide, or any components of the medication, anuria, inability to produce urine, significant renal impairment, hyperkalemia, high levels of potassium in the blood. Special instructions: use caution with potassium supplements, salt substitutes, or other drugs that may increase potassium levels, as aldactazide can cause hyperkalemia. Aldactazide may not be suitable during pregnancy, especially in the second and third trimesters. Regular monitoring of potassium levels, renal function, and blood pressure is essential during aldactazide treatment. Side effects: common side effects of aldactazide may include hyperkalemia, hyponatremia, hypertension, dizziness, gastrointestinal disturbances. Serious side effects are rare but may include electrolyte imbalances and changes in renal function. Any unexpected or severe actions should be reported to the healthcare provider promptly.